Hi, I'm Dr. Mike Jones, Hospital Director at Woodland West Animal Hospital. At Woodland West Animal Hospital, we believe dental care is very important to your pet's overall health. On the day of the procedure, you will be greeted and checked in at the front desk. Our technicians will take your pet back and begin the procedure to help with your pet's overall dental cleaning. Every patient brought to Woodland West for a dental procedure undergoes a pre-anesthetic evaluation with a doctor, as well as a pre-anesthetic blood profile to check for any underlying infection, clotting disorders, or organ dysfunction. Your pet is given an injection of an opioid pain medication as well as a sedative. These medications will help relax your pet and make sure the procedure and recovery are pain-free. Once your pet is pre-medicated, an area of the arm is clipped of hair, cleaned, and a sterile IV catheter is placed. After the catheter is placed, medications are administered through the IV catheter. These medications are called induction agents and help your pet fall asleep. Once asleep, a breathing tube is placed into the trachea and he is placed on an inhalant gas anesthesia, as well as oxygen. Our dental procedures are performed in a special room of the hospital so that any bacteria from the procedure doesn't affect other patients. This room is fully equipped with all of our dental equipment, anesthesia equipment, and monitoring equipment. Your patient will be connected to multiple surgical monitors, including an ECG to monitor heart rate, an O2 monitor to measure oxygenation at the tissue level, and a blood pressure cuff to measure blood pressure. IV fluids are also given while the dental procedure is performed. During the procedure, a full exam is done of your pet's teeth and gums. Any areas of concern are noted by the technician. The teeth are then cleaned using an ultrasonic scaler, which breaks down the plaque and tartar to remove it from the tooth. The teeth are then polished to smooth out any rough surfaces caused from the scaling. Any surface of the tooth that is clean has to be polished. The gums are probed with a special tool to check for any deep pockets. Radiographs are taken to check for tooth root abnormalities or problems. The doctor will do a full review of all findings and consult with you on the best treatment for your pet's dental health. Sometimes a patient will need extractions. In this case, a nerve block is done so that your pet remains comfortable during and after the extraction. Depending on the extraction, sutures may be placed and antibiotics and pain medication be sent home. Final radiographs are taken of the extraction sites to ensure all roots have been removed. While the patient remains on oxygen, the anesthetic gas is discontinued and the patient is discontinued from the monitoring equipment. The oxygen is discontinued and the patient is taken into recovery, which is lined with blankets and heating. He is kept warm while he is awakened from anesthesia by the technician. Once he is able to swallow on his own, the breathing tube is removed from his trachea. He is kept in a quiet area and monitored closely while he recovers. Before leaving the hospital, the IV catheter will be removed. Once home, allow for your pet to take it easy for the rest of the night. If he had any extractions, it may be best to feed softened food for a few days. The sutures used for any extractions are absorbable and do not need to be removed. When you pick up your pet at the end of the day, you will be given a report card that will go over all things that were done with your pet. The technician will be able to discuss any discharge instructions or home care that is needed for your pet. Again, thank you for trusting Woodland West Animal Hospital with your pet's dental needs.